Okay, so we'll call the meeting to order. It's 1 minute after 2 o'clock.
4 minutes.
We'll start the Seneca Hospital Board meeting with a call to order and roll call. Members present. Ken Crandall.
Here.
Ryan Lee.
Here.
Rich Rydell.
Here.
Jerry Nielsen.
Here.
Jerry Nielsen.
She stated here.
Here.
Oh, I can't hear it. And David Wallace. We will start with the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
That will bring us to the public comment period, and I believe that, are you Mr. McDonald?
Yeah, I'm reading the public comments aloud here. I have more question than a comment. Mainly I was concerned about this bond issue that I was told would be necessary. I have all the particulars here I need to know about that. But maybe I can make a comment that is related to something on your agenda, which is the construction of this new hospital. I was the head of the maintenance department at Sonoma State Hospital for 28 years. We went through this whole fire life safety environmental issue that you're going through to also ADA, and of course we fell under federal and state guidelines. We were able to meet. Do you have citations for any from the licensing board or anybody on a hospital?
Citations as being cited for being out of compliance. No, we have had analysis done by architects that we do not meet the minimum requirements for what they call OSHPD 1.
But
Yes,
you do not have official citations from the state of California threatening your license.
I don't think anybody's threatened. I don't think anybody's going to cite anybody.
Well, we have plenty of them, let me assure you, not only from the state, but from the federal and from Social Security, which we fell under. In order for Sonoma State Hospital to meet all of these requirements, federal and state, we went through a remodeling process, okay? It costs far less than a totally new building. I'm just wondering, have you guys investigated the possibility of remodeling?
Yes,
Sorry, my voice.
That's okay. You want some water or anything? You want water? Yes, so we have actually.
You have,
Some of the first things we did initially was to take a look at the building and the existing exoskeleton, the building itself, the infrastructure, and are we able to bring it up to the OSHPD 1 level for seismic requirements? And the analysis from the architects was it was going to cost at or more to retrofit this. It has asbestos, it has old pipes, so you have to really literally tear it apart to rebuild it. So yeah, there was analysis done.
that pretty much concludes my concerns. The rest of it's all in here. I see it's gonna be another $400 property tax, which I don't appreciate one part of it, I'll tell you.
And nobody does. I don't think that I can't point to anybody in here who wants to pay more money, especially now,
Especially
now.
it's gonna cost you $300 an hour to fly your airplane.
And it's going to cost me a lot more than that there, Craig, believe me. That's why it's sitting in the hangar.
Tell me about it.
So, you know, when you mentioned that I talked to you a while back and I said that there would be no bond necessary. I said that what we're going to try to do is philanthropically raise the money, which we still are. We're still trying to offset as much of this as possible. Do I think we're going to get to the ability? Do I think there are enough people that are out there willing to commit their trust funds to philanthropic efforts for the hospital enough that we can offset the cost? No, I don't think so. The bond initiative is really the only way to get to the final number. We're going to fund a lot of it. This is not just funding 100% of this thing. We can absorb a debt service of between 26 million to 30 million as a hospital just from revenue, which we are doing. So this is to offset the difference between what we can pay for as a hospital and not go under, and what we need to build this hospital. I can tell you that we are working on every possible way to economize the build of this hospital, including a thing called component build. So rather than sticks and bricks, the old fashioned way, these are actually, if you look at a hospital, they're built in sort of Jenga. They're rectangular buildings, right? They're rectangular rooms everywhere. So having it built in a factory, so we're not affected by winter or anything else, and then shipped in and laid into the foundation is sort of the way we're going. We believe there's cost savings there on that, and it's proven to be cost effective to do this. And we have also got state approval to do that. It looks like the OSHPD, the controlling body, is all in it for us. So we're trying to be as creative and innovative as possible in the way that we approach this, and cost effective. Obviously, I'm a big steward of not spending money if I don't have to. But ultimately, that facility in its current state and in any state that we put it in will close in 2030. That's just the way it is. We're trying to avoid the compression zone, what we call the 5-year compression. So hospitals that have to do this, that are waiting until that last minute, last hour, are going to be struggling with labor, because labor is going to take the prices up because they know that there's a deadline. We are trying to get well ahead of that so that we don't see that 30% rise in cost. Unfortunately, we're seeing rise in cost in everything. So we actually don't plan on digging dirt until spring of 2024. So hopefully we'll see a decrease in pricing. I mean, we're all crossing our fingers, right? Including the price of aviation fuel. But that's where we are right now.
I'm not really familiar with what area Plumas County is covered under the Seneca Health Care District. The lady I talked to this morning told me, does that include all of Plumas County?
No, it's just District 3. So this bond will only go to the hospital. It will not go to the county. The funds cannot be tapped by me. They can't go to pay me or anybody here. No gas money. Well, that would be a good idea, wouldn't it? You might be able to write that in. No gas money. It cannot go to the county. It doesn't go to the general fund. It can only be used for one thing and one thing only, and that is the build of that new facility.
Okay, I understand that. But how many of us are going to be paying for this?
Everybody that owns a house here, including full-time and part-time property.
It's not just a house, but a
Property.
property.
Yeah, but where's here? What
Where-
area? are we
What's
in?
our catch area? I'm sorry.
Yeah.
So District 3 basically is our catch area. So it's the Elmore Basin, all the way around the Elmore Basin, Clear Creek, but not up to Lassen County. I think Lassen County might be in Clear Creek, right? Haynes Creek, Childs Meadows. So all that area is what we consider to be our primary catch area. And that's the area that will be affected by the bond.
You're not going to be paying 80% on these bonds, are you?
Not if we hurry.
No, the Fed just raised the.
But see, the entire loan though is going to be through the USDA. So USDA has an extraordinary rates. We're not going to the market necessarily. The bond may be floated to the market, but the USDA will be the lender. So our loan percentages, and I may be wrong, and Steve, if you're on, he's my CFO, he's got the numbers calculated. We're going to lock this in from USDA at a low interest rate. As low as
What
we
I'm
can.
referring to is the interest on municipal bonds.
Uh-huh.
Okay, we own lots of them.
Uh-huh.
And it says the maximum of 8%. What do you project you'll be paying? The going rate right now is about 4%.
Craig, I can't answer that question. I'd have to have our financial municipal advisors answer that question.
The more you.
Because they're structuring the deal.
Okay. Not to harass you guys as much.
No, we appreciate it, actually. I mean, I appreciate it, you know that. But
Okay.
anything else I can answer while you're here?
No, that's a good question. All right, sorry to go you guys. I've got some answers. I understand the situation better. Oh, where is this property? Is it that over there?
That flat 10 acres,
You're asking for a heliport
we're getting a heliport.
over the top of this?
No, our new flight paths are then coming over. They come this way, but their primary is going to be over the Collins Pine area.
Yeah, I'm gonna say, you're waking up a lot of people on that.
Yeah, we've been very much considering the fact that helicopters, make noise.
We've been-
Okay.
All right,
Us
Well,
pilots are
actually-
out here.
you know where to find me.
Actually, the helicopter makes noise now when it lands at the airport.
Yeah.
I mean,
Wait till they bring a Huey over.
Or the Blackhawk.
And you know something else? We used to land the helicopter right out here in the parking lot. Yeah. Yeah, and it threw up so much debris that Chuck Davis, who used to own the supermarket in town with David Price.
Yeah.
It destroyed his Mercedes. And we had to pay to repair that, and they stopped landing the helicopter here.
I suppose the guy didn't have helicopter insurance. either.
Yeah, probably.
All right.
Thanks for showing up, Craig. Appreciate it.
Thank you.
Okay, is there any other comments from the public? Nothing was submitted. And are there any people attending remotely? TK, do you know of any guests that are attending remotely? Okay. Then we'll move on to the, let's see, I think I forgot to make a notice that we're going to have a closed session. I'm sorry. There will be a closed section regarding the health and safety code 32106 regarding trade secrets. So we'll move on. Discussion and vote. I guess, do you want to take care of this?
Yeah, so we have legal on the phone if they would like to go over. This was, I'll just kind of preface this by saying that in order to bring this ballot and put it on the ballot measure, we need board resolution to take it forward for this GO bond. That is per guidance of our legal counsel, of our bond counsel. They are all on the phone. So if the board has questions specifically and directed toward our legal counsel as it relates to the procedure, requirements to put it on the ballot measure or the ballot measure itself, I'd welcome your questions, and I know they're on. So legal counsel's on if you'd like to discuss it with them.
Any comments or questions? Rich, do you have any?
No, let's move on.
I can barely hear.
Yeah.
As long as we'll go.
You said let's move on. He's fine.
I'm good.
Okay. Jerry, do you have any?
No questions for me
comments?
either. No, I'm good with it. Thank you.
I guess nobody
We
has
need a
any
motion?
comments. Ken or Brian?
I have no questions.
No.
Okay.
You need a motion?
Hear
Then
me
we
out.
move on. There's no,
You vote the resolution. I believe we need a vote to bring the resolution so that we put this on the ballot.
So moved.
Is that correct, legal counsel? We need the board to vote to bring the resolution.
Yes, we need to make a motion and
Yes,
vote.
discussion and vote. So the resolution's in the packet. If you've read it, we probably need a board vote to approve the resolution.
let me see. I read this. Where is the resolution?
It's under tab
Tab A.
A.
It's behind the yellow sheet. Yeah, that's it.
Jerry, I'll make a motion to pass or to vote on the resolution.
I'll second.
Motion by Jerry and second by Ken. We'll take a voice vote. Rich,
Aye.
Jerry?
Aye.
She said aye. Ken,
Aye.
Ryan,
Aye.
and I will vote aye.
Thank you.
Yeah.
I'll be taking this into the county next week to get it put for the ballot.
And you need signatures on this today, Ryan?
I do.
Ryan, sorry.
I have the signatures here for, so after the meeting, if you would like to stay and just sign.
Yeah. Should only take 5 minutes or so, right? And
I'll
I
do
have
that.
4:15 appointments.
Yep.
Does the president of the board have to sign?
She'll sign tomorrow morning when she gets back in town,
Okay.
or Friday morning.
Right.
All right, then we'll move on with the April financial report. Is Steve here?
He was.
Can you all hear me?
You go ahead, Steve.
If you hear him, or if you can hear us.
You guys hear me okay? Okay. Great. All right. So in your packet, in tab B, I can hear you. So in your packet in tab B are the financial statements for April. We are getting close to being back into our regular rotation. I have no reason to believe pending, I will be presenting the at the June board meeting. And so again, thank you for your department. But for the month of April, and there's a couple things I just want to go through with you all. We did experience I'm on page 2 now. It might kind of be easier to look at page 2, the little schematic income statement. So we did experience a net loss of just under $517,000 versus a budgeted loss of $228,000. So we had a negative variance of $289,000. So that's certainly something worthy of some discussion. The bulk of the difference was in our operating expense, or the bulk of the variance was driven by operating expense variance, which was $215,000. There were a couple of things going on there. First is the salaries and wages were negative to budget, just under $80,000. In the month of April was when we reached agreement with the Teamsters Union on the 2022 contract. And per the contract, the amount that you all approved and that we had presented, 4% for for union members, non-exempt employees, and 2% for management exempt employees, was retroactive back to January 1st. This retroactive payment that we made and was all recorded in the month of April was just over $50,000. The way that our accounting system works is that the accrual is calculated through our payroll system, and so they accrued on this higher amount. We could have put a little adjustment in there to reduce the accrual, but I just let it fly. And so between those two, the 50,000 and the accrual is the bulk of that variance on salaries. Under contract labor and also in purchase service, in the month of March, we had another staff go on a leave of absence, and our accounts payable, we had a bit of a timing difference where some expenses from the month of March were not recorded until April. A couple examples is we had approximately $24,000 in our contract labor for the registry nursing, mainly in long-term care, but also within the hospital, that related to March that we recorded in April. We had a couple invoices from the purchase service for our IT, or our previous IT, CSI, for the month of February and March that did not get recorded. That added up to, between the 2 months, a little over $22,000. And then in the month of April, we began our new contract with Apex, which is approximately $18,000 a month. We'll have a short overlap of those two services for the next couple months. The final piece of that, and this is a good news, bad news, is we paid HRG, our outside business office, approximately $29,000 based upon a cost report settlement. So in the narrative, you see that our days of cash on hand increased 16 days, and it was primarily due to the settlement of our fiscal year ending 6/30/21 cost report. We received about $950,000 from the actual cost report. And then what they do is once the cost report's settled through June 30, they'll take the new rates. And if we receive a settlement payment, it means we were underpaid, so they increase our rates. So they increased our rates effective July 1, and they ran it through a period of time, February of 2022, and provided us another $480,000. So we received almost $1,450,000 in cost report settlement funds, and HRG receives a commission on that amount. And the reason they receive a commission on that amount is because it's based upon Medicare claims. So it's a claims-based thing. And in essence, what happened is Medicare underpaid us on individual claims. So if they were paid us correctly, HRG would have received their commission, their normal commission, as the claims process. So this is standard. I have no problem with it. And so that was about $29,000. Let's see, we had, that was purchase service. Oh, the professional fees, medical. And so there's analysis. You don't have to jump back there. I'll go ahead and just run you through it. We had a negative variance of approximately $42,000 on the medical professional fees. And this was made up of multiple things. Surgery has started to pick up again. Dr. Jensen's been quite busy. He's actually gone to where he's now doing 1 day of the surgery and 1 day of clinic. He's no longer able to do everything in the same day. So that's great for us. The revenue's up, and correspondingly his professional fees. Same thing with Almanor Physical Therapy. They're seeing more patients, and then in turn we pay them more money. The Lake Almanor physician fees, the clinic fees, our physician, the fees were up, and this is a timing thing that we're not able to bill until charts are completed, and they're not always completed within the when we close out the month end, and so we can have a catch up, if you will, where the charts are completed, the revenue's generated, we bill it, and then the physicians receive their payments based upon their production or their RVUs. And the final piece was the professional fees other, which right now there's a myriad of things we're working on, including the folks that were on the phone today. So working with the new hospital build and general hospital legal relating to contracts or other matters. And then we have one matter that's in a litigation status. So, I just wanted to, expenses were the main driver, but we were also negative to budget on revenue. But the thing about the month of April is we had a little turnaround in our outpatient revenue. We saw higher volumes in the ER, again, in surgery, physical therapy. We did, the way we record it, we saw higher volume in revenue for the clinic, but it was, again, that catch up of chart completion and billing more than it was patient visits. And we've started to see a decrease, at least in April, of our inpatient volume, where we had very few inpatient days and we had no swing bed days. We've seen that continue a little bit into May, but we've started to have a couple swing patients, and so we should see a little more inpatient revenue in the month of May, and the outpatient revenue continues to grow. And as we go into June now, we've seen some really high volumes in our emergency room. So I guess that's it. Any questions or comments or concerns?
Steve, I'm a little curious about, you're referencing documentation and it's lagging behind, and causes, if I understand this correctly, billing to lag behind makes sense, I guess. How far behind?
Oh, it's usually the previous month. We can have some issues with a variety of things. that can lead to that, whether it's an information system thing, whether it's specific things impacting a particular provider. But it remedies itself ultimately. We're going to try and certainly with the new Cerner system, I think that it's really going to allow us to be a little more, I don't know what the right word is, so I'll just say a little more aggressive with the way that we create expectations for chart completion and the matching of revenue to the proper period. I think that's something an area that we need for improvement, so that that we can have a more accurate representation. And again, it does lead to a timely billing. I think when we look at the May AR report that I'll present to you at the end of the month, our unbilled jumped up again, and it was something as simple as having incomplete ER charts right at the end of the month, and that can be significant. That can be significant to our revenue. So at least the timing of the revenue, and when we look at that unbilled number, we'll see it go up and down. And ideally, we want it around 5 days, and then that lends itself to converting the revenue to an AR to cash within our 45-50 day target.
So is this tracked as a quality assurance measure?
Yes,
It is.
yes, and reported.
Mm-hmm.
Okay, that answers my question. Thank you.
You bet.
Is that the
Any
end of-
further?
Steve, no question.
Any questions or comments on the financials?
And actually, one more thing for Jerry. So Jerry, pursuant to a discussion we had at a previous board meeting, ADP has contacted me, and they have created a means to interface, at least with CPSI, more efficiently with the month-end payroll. So that's a real positive thing. And so if they can do that with CPSI, I have no concerns that they won't be able to do that with our new vendors. So that was something that Kelly Pettigrew had been working on with them. So it was a very nice surprise.
Fantastic. Thank you.
Yeah, okay. That's it.
Thank you, Steve.
All right, you guys.
With that, I would like to accept a motion to accept the financials.
I'll make the motion to accept the financial report.
Is there a second?
I'll second it.
All in favor? Rich?
Aye.
Jerry?
Aye.
Thank you. Ken?
Aye.
Ryan?
Aye.
And I vote aye. That will bring us up to the closed session. And I think as soon as the cameras go down, we can go right in. We don't need to take a break. Hasn't been a very long meeting. So the closed session has concluded, and there was no reportable action taken during the closed session. The next regular board meeting will be June 30th of this year at 3 p.m. at the Lake Almanor Clinic. Meeting is adjourned.
Great.
You. Bye.
Okay.